Assalamualaikum, welcome to Medical Corner. Today our topic of discussion is how to perform the diagnostic test of the shoulder joint to rule out the shoulder pathologies. The first one is the painful arc sign, which is used to diagnose the painful shoulder syndrome. Firstly, we instruct the patient to fully abduct the arm. If the initial and the end ranges of the motion are pain-free, but between the 60 and the 120 degrees, the patient complains pain at the level of the acromion process. It means the patient is a candidate of the painful shoulder syndrome and the painful arc sign is positive. To examine for the painful arc sign, instruct the patient to abduct his arm. In the initial and the end ranges, the motion is painless, but between the 60s and the 120 degrees, the motion is painful. If the patient presents like this, it means the painful arc sign is positive. And the second test is the drop arm test, which is used to test the integrity of the rotator cuff muscles. In this test, the patient will be in the sitting or the standing position, and the therapist will passively elevate the arm of the patient to the 90 degrees and then leave the arm of the patient. Then actively, patient lower his arm to the side. If the patient drop his arm without any control or complains the severe pain during the movement, it means the drop arm test is positive. Okay, the third test is the Mears impingement test, which is used to test the integrity of the rotator cuff muscles. In this test, the patient position is sitting or in standing. In this, the therapist passively medially rotate the arm, the thumb in the downward position, and then elevate the arm of the patient passively. If the patient complains the pain, then it means the Mears impingement test is positive. Okay, look at this video of the Mears impingement test. In this, the therapist will internally rotate the arm of the patient and then elevate the arm of the patient. Look at this, internally rotate the arm and then elevate the arm of the patient. If the patient complains pain anterior to the shoulder, it means the patient Mears impingement test is positive. All the previous tests, that is the painful arc sign, Mears impingement test and the drop arm test, is used to rule out the painful shoulder syndrome or the integrity of the overall shoulder rotator cuff muscles, or to rule out the subacromial impingement. But now we'll do the individual test for the individual muscle. So the first one is the empty can test, which is used to test the supraspinatus tendon pathology. In this, the patient is in the sitting or in the standing position. Therapist will medially rotate the arm of the patient and thumb will point downward. Just like this, thumb will point downward, and then we'll command the patient that elevate the arm, and therapist will resist the movement of the patient. If the patient complains the pain or the movement is weak, then it means the test is positive for the supraspinatus muscle. Okay, look at the video of the empty can test. In this, the patient is in the standing position and the patient will elevate his arm to the 90 degrees and then internally rotate his arm, that his thumb pointed downward, and now the therapist will resist his movement to the elevation. If the patient complains pain or weakness, then it means the tendon of the supraspinatus muscle is involved. Okay, so this next test is the Hawkins-Kennedy test, which is also used to test the supraspinatus tendon pathology. In this, the patient is in the sitting or the standing position and passively flex the shoulder of the patient to the 90 degrees and also flex the elbow of the patient to the 90 degrees and then passively internally rotate the arm of the patient. If there is a reproduction of the symptom and basically the symptom is the pain, then it's mean the supraspinatus tendon pathology is there and the Hawkins-Kennedy test is positive. Okay, look at the Hawkins-Kennedy test. Elevate the arm of the patient to the 90 degrees and then internally rotate the arm of the patient. If there is the provocation of the symptoms and symptoms are especially the pain, it's mean there is a pathology of the supraspinatus tendon and there is the subacromial impingement. Okay, the next test is the infraspinatus stress test, which is specially used to test the infraspinatus muscle. The patient will be in the sitting or the standing position and the elbows are in the 90-degree flexion and the patient will externally rotate the arm and the therapist will resist the movement of the patient. If the patient is unable to do this movement, it means the infraspinatus muscle is weak. And if there is a pain during the movement, it means there is the impingement of the infraspinatus muscle. Now look at the infraspinatus stress test. In this, the patient position is in the sitting and the patient will flex his elbow to the 90 degrees and now the therapist will resist his movement and the patient will try to do the external rotation at the arm. If there is a provocation of the symptom, it's mean there is the infraspinatus tendon pathology. Okay, so the next test is the lift-off test, which is used to test the subscapularis muscle integrity. Okay, in this the patient position is upright and instruct the patient to bring his arm behind the back, that is the internal rotation at the arm, and then instruct the patient to lift his hand behind the back if and maintain the position this position for some seconds. If the patient is unable to maintain this position, it means there is a pathology in the subscapularis muscle or there is the tendon rupture of the subscapularis muscle. So the next test is the speeds test, which is used to test the bicep tendon pathology, especially the long head. Why the long head? Because only the long head of the bicep is passing through the subacromial space. To perform this test, ask the patient to fully supinate his forearm and fully extended his elbow, and then command the patient to flex his shoulder and the therapist will resist his movement. If the patient complains pain in the bicipital groove, it means the speeds test is positive and there is the pathology in the bicep. So the next test is the Yergason's test, which is also used to test the bicep tendon pathology and the slap lesion. In this, the patient sitting or in the standing position and the elbow flexion at the 90 degrees and the forearm in the pronation. Then command the patient to supinate his forearm and therapist will resist it. If the pain in the bicipital groove, it means the Yergason's test is positive. So the next test is the Horns-Blower's sign, which is used to check the teres minor integrity. The patient is in the sitting or in the standing position and then command the patient
to lift the both hands to the mouth. If the patient is unable to lift his hand without abducting the arm, it means there is the rupture in the teres minor tendon and the Hornsblower sign is positive.